Good day. We are still busy with the Mother Baby Friendly Initiative series. I'm still Anna Nolte, and now we are going to do session 3, and we are going to help to assist the mother to getting the baby to latch. So we're going to talk in lesson 1 about the baby's feeding cues and the different positions. And then in lesson 2, we're going to talk about the attachment or the latching to the breast. And then in lesson 3, I'm just briefly going to tell you about an observation tool that one can use to observe the mother's breastfeeding to see whether it's going well or not and identify the different problems. In this lesson, we are going to talk about the baby's feeding cues and maternal and baby position, which I think is extremely important for breastfeeding and the total success of breastfeeding. It might feel like general knowledge that you have all this knowledge already, but I think it's just then, in that case, a very good revision of your knowledge and to just make 100% sure that you are on the right track. Now, all these series and sessions are about the 10 steps to successful breastfeeding. And we are here in this lesson busy with step number 5, which says that mothers should be supported with breastfeeding and that the hospital should support mothers by checking and positioning attachment and suckling. That's what we're going to do today. Give practical breastfeeding support. Obviously, the things that we learn today, we obviously also have to teach mothers on, and then help mothers with common breastfeeding problems. That will come in another lesson. So if we look a little bit more close at step 5, which is now the support of mothers with breastfeeding. If we look at the rationale a little bit more closely, we see that postnatal breastfeeding counseling and support has been shown to increase rates of breastfeeding up to 6 months of age. I think this is general common knowledge that the more we teach and the more we support mothers during breastfeeding and helping them with breastfeeding, the more successful they will be. And this includes both hospital as well as out of hospital, after hospital counseling and support. So early adjustments to the positioning and attachment can prevent breastfeeding problems at a later time. For example, engorgements of breast, um, sore nipples, etc. Frequent coaching and support helps mothers building confidence, and we have talked in the previous lessons about how important maternal confidence is, for example, for the whole breastfeeding experience, for the success of breastfeeding, but also specifically for the lay down reflex to happen. Now, if we look at the implementation standards, how do we implement this in our practices? We give practical support to all mothers within 6 hours after birth. Now, this is important for 2 reasons. The one is that this is usually now the second time that the baby will latch after the first skin-to-skin latching experience. So the mother will need a lot of teaching and education and help and support to latch the baby correct. This is also very important for patients and midwives in public hospitals because there are so many mothers that's been discharged after 6 hours after the birth. So they really need to learn the absolutely optimum in this first 6 hours after birth. To demonstrate the appropriate positioning and attachments with the mother and infant, and to enable the mothers to successfully breastfeed. To use key messages and illustrations on the Road to Health booklet, and this is important for the mothers to understand their growth and weight gain for their babies, to determine whether the babies are getting enough milk or not. Observe the mother breastfeeding using a breastfeeding observation aid. That's the tool that I will teach you about, and assist all mothers with questions and problems related to breastfeeding and build the confidence and in their ability to breastfeed. And we've just talked about how important this confidence is. Demonstrate to all mothers how to express and handle and store breast milk. This will come in the next lesson. The importance of ensuring hygiene and safety using a pump will come in next sessions. The engorgements of the breasts and the sore nipples will come when we talk about the different problems, breastfeeding problems, and then also mothers with twins and preterm mothers will come in the next session. Then I'm going to skip the part on special babies who are in special care neonatal units because that will come in a next lesson. But what is then important here is that at least 80% of breastfeeding mothers or term infants report that someone on the staff offered assistance with breastfeeding within 6 hours after birth. These are the important things, like in the previous steps, or when the Department of Health comes to audit your hospital. At least 80% of breastfeeding mothers are able, of term infants are able to demonstrate correct positioning and attachment, and that the baby can suckle and transfer milk. And at least 80% of breastfeeding mothers of term infants can at least describe 2 indicators of how to facilitate milk production and to ensure that babies consume adequate milk. And then the last 3 is about breastfeeding and preterm babies, expression of milk, and then also again expression of milk. So we are going to talk regarding this specific step mainly on positioning and attachment, and teaching the mother the different cues of when is a baby hungry. Now, the cues are, before initiating a breastfeeding session, assess the infant's readiness for feeding, and we will come back to this just now. The better, the more ready the infant is to accept his breastfeeding, the more successful it will be. And we all know these signs of readiness. You will see it on the video that you will watch on the positioning, but you will also, I think we all know it, licking and sucking movements, lip smacking, rooting hand to mouth movements, sucking on the hands, increased activity, and then crying is a late sign. Now, the reason why we teach the mothers these cues is that it's very frustrating to try and get a baby that's in deep sleep to attach the baby to the breast. So the baby needs to be hungry and awake, but also when the baby should start before, the feeding should start before the baby starts crying, because when the baby is crying and gradually the baby is getting more and more angry, and we will see also now here that when the babies are distressed, there's an increase in their adrenaline secretion, and that makes it very difficult to calm a baby then down after he's been so cross and so angry that he's not been put to the breast immediately. And also then when the baby is cross and angry, there's a delay in the oxytocin and release of the mother. So there's a delay in the letting down reflex. And this then causes a total negative, bad cycle for both the mother and the baby. So that's why it's important that the mother should start feeding the baby before he gets distressed, but also not waking the baby up when he's in deep sleep. But we have said in the previous lessons that it's very important that babies for the first 2-3 days should be woken up, because many of them might still sleep because of the influence of their mother's pethidine or other problems. So initially it's very important to wake the baby up for his sleep. Later on, the baby will be able to tell you when he's hungry or not. Then we also divide these cues into early cues and later cues, and mild cues and late cues. Now, for example, when the baby stirs, his eyes and mouth is opening, is wriggling, is moving his arms and his legs. I think we've all seen babies waking up like this. There's rapid eye movement, and these are the early signs of hunger. Then they change from early to mild. The baby roots and drools, he makes lip movements, he turns his head and tries to get his fingers into his mouth. There's an increased alertness, awakening in facial expression, and he stretches the arms and the legs, so he's tossing and turning and wriggle. This is mild. Then he starts fussing and squeaky noises. Then he starts crying intermittently, and then he screams and he turns red and he's really angry. And this is a late sign. So what we need to teach the mothers and ourselves is that when the baby starts with early signs, that's when the mother should start getting herself and the baby ready for breastfeeding. Get her pillows ready, get herself in the correct position, um, change the baby's nappy if necessary, etc. So, and then start with breastfeeding, preferably when the baby is in these earlier and mild stages. But to prevent, and she shouldn't start here when the baby starts making squeezy and crying noises already, because by the time that she puts the baby to the breast, he's going to be angry already. Now, positioning of the baby, I think to a very large extent is general knowledge for many of you. But still, there are very important principles that one need to just reconsider. And again, these are things that's very important to teach the mother as well when she's breastfeeding. First of all, a comfortable and a sustainable position is very important. Because if the mother is not comfortable, obviously she can't sustain the position. And if she can't sustain the position, two things happen. First of all, when she's uncomfortable and not relaxed, there will be no lay down reflex. And then also, the baby won't be able to properly drink, and the breastfeeding session as such will then also not be sustainable. And specifically, the neonatal mothers, the mothers who are breastfeeding for the first time, and mothers who has recently given birth, excuse me. So for the first 2 or 3 days, the mothers really need help with this and support with this. So the baby must be well supported with pillows, etc. So the baby's body must be supported, and we will come back to that again. And the mother must be comfortable, as we've said. If she slumps forward, she will get back pain and then obviously discomfort, and as we've said, all the if possible effects of discomfort. So the different positions, first of all, there's the lying down position. Is now these positions, as many as there are individuals, so many differences will there be in what mothers prefer and what position mothers prefer. So we need to teach mothers that they also have to trial and error on the different positions and see what works best for themselves, and also what works in the first 2 or 3 or 4 days after birth are not necessarily the things that work best after she's been home and has gone home. So she, as I'm saying, really needs to trial and error and just remember the most important aspects regarding her position. Now, the lying down position is when the mother lies on her side, like you can see here on the photo, and this is usually a comfortable position when the mother has a perineum that's very painful because of an episiotomy or just bruising or following a cesarean section. And many mothers might also prefer this position when they are feeding at night, when they are just getting the baby with them in the bed. Now again, like we've said, the mother should be comfortable. She should preferably not prop herself up on this elbow, because that makes that the breast is then too high for the baby to reach, and the baby might not properly reach the breast. The other big problem with the lying down position is that the baby's head is too high up. The baby's head is not that the mouth and the nose is opposite the nipple. So it might help to just move the baby downwards a little bit. Now, the baby is lying on his side with his facing his mother, like you can see in this picture, so that his chin and his chest and his knees are facing the breast. And this is very important position for the baby, and we will come back to that several times again as well. Then the laid back position, or the natural latch position. This is similar to the very first latching position that the baby was in, that we've done in the lesson on the very first feeding, where the baby is being placed on his mother's abdomen. The mother is getting into a reclined position on a bed or a sofa or a chair. Again, she should be comfortable and she can use pillows to support her. It's very important that the mother should not lie flat on her back. And then she places the baby on a tummy. The baby can be closed or the baby can be skin to skin contact. It's a very good idea, especially with mothers who are struggling to latch or babies that struggle to latch, to use the skin to skin contact. And as we will see later on, skin to skin contact also helps to calm babies down if they are very cross and crying a lot. It can also help to wake babies up a little bit when they are very sleepy. So we put the baby in, as I've said, the same position on the mother's breast, on the mother's abdomen, with his head more or less level to her breasts, and his tummy basically touches her tummy. And then he will, like in the first breastfeeding, begin to smell and feel his way to the nipple and then self-attach. The laid back position, a little bit more about this position. What the things that we need to teach the mothers is that they should have a supportive surface and that they do not lie flat on their backs. It's just easier if they are supported with pillows in a little bit of a sitting or reclined position. It just makes it easier for them to help the baby or to attach the baby, and it's also just much more comfortable for them. And the baby lies as close as possible to her tummy with his core fully supported. So his whole body is basically on her body. If she had a cesarean section and it's painful, she might place the baby a little bit more to the one side so that he's just away from the scar and not causing any pressure on the scar. And there should be constant contact between the mother and the baby, and there should she shouldn't put any pressure on his neck or at the back so that he can use his neck and his head freely. And she should also relax freely in the chair or the bed so that both of them are in a relaxed position. It's very important that the baby's head should not be in a flexed position, and we will come to that again just now. When we look, for example, at the cross-cradle position, like you see here, what the mother does is she supports the baby's head with her fingers and her thumb here just behind the baby's head, basically in his neck, and then this arm supports the body of the baby as well, and then this arm is free to help the baby holding the breast or whatever way she wants to do. She can use, and it's preferable that she use pillows to support the body of the baby. And the baby again is being turned to the mother's body. He's facing the mother's breast. His chest is towards the mother's chest, and the rest of his abdomen and legs are also facing the mother's body. Now, the reason why it's so important that we shouldn't flex the baby's head towards the breast is if you flex your chin onto your chest, you will not be able to swallow or to drink, and that's why it's impossible for the baby to latch to the breast if his head is in a flexed position. It should be a little bit more kind of in almost an extended position, and there should be freedom that he can move his head, specifically when the baby gets more head control. It's much easier for him to move his head if his head is not be constricted. The cradle position, in this case, the mother places the baby's head in a bend of her elbow, and this hand is then also free to help the baby with the breast, etc. And again, the baby is being turned to the mother with his head facing her, his chin and his chest and etc. facing her. Now, this has been a position that's been used often by mothers, but it's been recommended that the previous position, the cross cradle position, should be used in first-time mothers and mothers that's not so, I almost want to say novice mothers, that's not so comfortable in doing breastfeeding, because there she has just more control over the baby and control over the baby's head specifically as well. Now, positions of the baby. Now, what we discussed previously were conditions of the mother. Now, what's very important are the positions of the baby as such. So, as I've said, never to push or to pull the baby closer, but holding him by the head. This will, if we push him closer with his head to the mother's breast, that will cause flexion of his head, and he will be unable to open his mouth properly and to latch properly onto the nipple. So he's been supported here at the back of his occiput part of his head, but under no ways should she push him forward. The head must be tilted slightly back, as I've said, so to ensure that his chin is here on the chest and that his nipple comes to his hard and soft palate. And you will see also on the video why this position is so important. And she support the base of the baby's neck with her open hand, and the neck is free to tip backwards or moves forwards to move the chin upwards. So the baby has much more freedom in his head, if I can call it like that. The baby's head and body should face the breast. It's very difficult again. If you turn your head like this, you will also see that it's very difficult to swallow and to get a proper grasp on the nipple and to properly attach. Then you will see on the video how important it is for the baby to be aligned, for the ear, the shoulder, and the rest of the baby to be in a straight line. It just helps the baby to be more comfortable and to again get the breast in the best way without twisting the baby's neck. Now, if we look at the 4 key points of positioning a baby to the breast to ensure good latching, first of all, the baby's head and body should be in a line, like you've heard now before. The ear, the shoulder, and the arm and the rest of the body should be in a straight line, so that he can swallow easily and that his head is not flexed and he can easily get the nipple into his mouth. The baby should be held close to the mother's body. This is also very important, so that the baby is close to the breast, that he doesn't need to reach to the breast. That will help him to also get attached or latched properly to the breast. But also, on the other hand, the baby should not be held too tightly to the mother's body, like in some of us don't like to be constricted too much, and the baby might become wriggling out of this very strong grip on him. So the baby must just be comfortably close to the mother for different reasons, for his security reasons, for him to comfortably reach the breast, and for his security to just feel his mother close to him. And then his whole body is being supported with his mother's arm around his back. And then the baby approached the breast, nose to the nipple, like you can see here on this photo. The nipple and the nose and the nipple are opposite each other, and that makes that the nipple act as the stimulation, the root reflex, to stimulate the root reflex, which will make that the baby opens his mouth widely and stretch open his mouth and reach up for the nipple, like we will see in the next slide. Just a little bit about the positioning of the mother's hands. She can hold her fingers, like in this case, where we call it a scissor grip, where she puts a first finger on the top of the areola and the second finger on the bottom of the areola. And in this case, she uses her thumb and her forefinger on different sides of the baby's, of the areola, in the effort to just shape the breast a little bit different for the baby to get hold of. And you will also see this clearly in the video, or to open, to keep the baby's mouth open from the breast. Just a little bit more about this. It's very important that the mother can compress the breast a little bit to give it a better shape, in inverted commas, to fit in better in the baby's mouth. And what's very important here is that her fingers should be far away from the areola, as you can see here. If it's too close to the areola, there's not enough space for the baby to get a large part of the areola into his mouth. So that's very important. And then she can also use this grips, one of these uh, finger scissor position or palm position, to hold the breast away from the baby's nose so that he can breathe easily. Okay, now you can watch this video on the different positions for breastfeeding. It gives basically a summary of what we have said, what I've taught you just now in this whole lesson. I hope you enjoy the video. It's actually quite a good video. And that brings us to the end of this lesson. I hope you have learned something new. I hope you enjoyed it, and you can please complete the quiz before you go to lesson 2. Good day.